Welcome back to Skin to It. I'm Dr. Sandy Skotnicki, board-certified dermatologist.
And I'm Marlo Sutton, fashion stylist and skincare enthusiast. Funny that I have to read that. Today, we're tackling something so many people deal with, facial redness. It's huge. It's huge.
Yep.
And obviously, it's not just one thing. It's what we're going to learn about today, many different causes. And I think a lot of people are going to be excited to
I think this is going to be
learn what they can.
This is going to be a
do for their
well-listened
facial
to
redness.
episode. Yeah.
For sure.
So before we jump in, I want to acknowledge our sponsor. This episode of Skin to It is brought to you by Bioderma, a dermatology-driven skincare company known for its science-based approach to supporting the skin's natural barrier. Bioderma develops products based on the principle of ecobiology, designed to work with the skin's natural biology to help maintain healthy, balanced skin. Marlo and I also want to give a shout out to Bioderma for sponsoring our first 2 seasons, really in getting us going on this journey. And so we're forever thankful to them for that.
Thank you very much.
Yep.
Okay, we want to get right into it. And, I love your stories. And I'm sure you have so many people who've come into your office with facial redness.
Yep.
So maybe let's kind of jump right in. And so someone comes to your office and they're complaining about this. And what's the first thing that you're going to do?
So one of the things that's really important is, and my kids often make fun of me, they're like, Mom, you're not really a doctor, you're a dermatologist. And yes, I am a doctor. I went to medical school. I did 4 years of dermatology.
School.
Yeah, exactly. So we have to, when I see somebody with a red face, we take a history. We look, we have an exam. History is very important because there are some weird causes of facial flushing. I mean, the most common cause, which is
rosacea.
Yeah, we're going to talk a lot about that. But there are other things that you have to not take for granted. So I talk about their skincare regime. I talk about, are they using retinoids? What are the over-the-counter products they're using? And medications. Some medications, do you know that vitamin B3, which is niacin, can cause flushing?
Yeah, no idea.
So I've had some people that it doesn't always happen right away. It can happen an hour or two later.
Okay.
And it's a real significant burn, right? Okay. And so you have to, if there's listeners out there that like niacin and you have that, you've got to take a slow release.
Okay.
There's also some very rare internal systemic diseases that cause flushing and blushing. Something called pheochromocytoma, some gut disorders.
Say that 3 times fast.
Yeah, you have to. So you do take a history, and then I think we were talking about earlier about we're doing a dermatology detective episode in a few.
This is my favorite thing. I'm so excited about that.
So I had this one patient come in, and she was challenging because she'd seen a lot of derms. She had this persistent red face and burning, and we tried a whole bunch of things. I said, okay, listen, try my product elimination diet where you're going to remove all your products because I'm really not sure what's going on here. And she was a real natural lover. She liked to use things that weren't synthetic, etc. We're not going to go down that rabbit hole. But she came back a few weeks later, and she was so happy. And she said, "You know what? I was doing great, and I reintroduced my frankincense oil. She was using straight up frankincense essential oil on her face, and within a few hours, she started to get this huge burn. And it actually can be a bit photo accentuated, I think. So it was also that when she went outside. So it was the frankincense oil. So these things, won't come up unless you actually take a good history.
Interesting. Yeah. So obviously you've kind of answered my next question that diagnosing this is not totally straightforward.
It can
be a little bit tricky.
Yeah. But I mean, the majority are some sort of rosacea or sun damage.
Right. So I guess what I didn't realize too is that I mean, obviously I know rosacea is the redness in the skin, but it can also burn.
Burn, yeah. So there's basically, as we just said, one of the most common causes of facial redness is a disease called rosacea. It can also be acne rosacea. It affects about 1 to 20. It was funny, I was reviewing the literature, 1 to 20%. It's a big thing.
That's a big range,
But it depends on countries. It depends on, because it's very ethnic driven, like Celtic background, sort of fair-eyed, fair-skinned people are more common. So you're going to have different percentages in different populations around the world, right? So what does it actually look like? Well, if we want to get a little technical, there's 4 subtypes. So the type
let's get technical, Sandy.
Let's get technical. Can you say erythrotelangiectatic?
Erythrotelangiectatic.
Very good. Yeah, very good. So erythema in Latin means red. Telangiectatic means little blood vessels that you can see. Telangiectasia is a little blood vessel. Some people just have redness. They
Yeah.
don't have the other parts. So there's kind of 4 parts to rosacea. You can get pimples, you can get pustules, you can have flushing,
Right.
you can just be red.
Yeah.
And some people get ocular rosacea. So it can affect, there's a big oil gland on the top of the eyelid, on the outer third of the eyelid called the meibomian gland.
Okay.
And rosacea is actually an inflammatory condition of the oil glands. That's part of the process. And when you have an inflammation in that meibomian gland, that's why you get ocular rosacea.
Right.
So sometimes I'll tell
So
patients,
look like bloodshot eyes.
actually the symptoms can be varied. Most people feel like they have dirt in the eye,
Oh, God.
like that kind of gritty sensation.
Gritty,
Some
yeah.
people have discomfort, but it's mostly sort of that feeling like their eyes are dry because they're not getting the amount of your sebum gland, the meibomian gland produces the oil component of your tears.
Okay.
So they can't moisturize their eyes well. That's what ocular rosacea is. So,
yeah, I had no idea. I didn't realize that. I know, I guess, and the other thing I didn't realize, when I think of facial redness, you think sort of more just on the cheeks.
Well,
but it can be like a full red face.
Exactly. And that's actually sort of segueing into our next section is how do we kind of tell the difference between some of these? So the causes of facial redness. So putting aside the more, rare things that we talked about at the beginning, the 2 main causes of facial redness that walk into my office are some sort of form of rosacea and sun damage. So what you just said.
So you damage your skin and like from before and it just stays red. I tell patients that, like the whole sunscreen argument, every time you go out into the sun, the UV rays are damaging your collagen and your elastin. That's the support structure for your blood vessels. Okay. So as you get older, your UV damage comes out as redness potentially and broken blood vessels. But you'll see it, like you just said, mid-face, kind of center of the face is more rosacea. But if you start to see redness on the forehead, outer sides of the cheeks, onto the neck, and the chin.
That's sun damage and chin. Oh. Yeah. Some people get this redness on the sides of their neck, but not right under the chin. Well, that's actually because your chin's like an umbrella. So over the years, you really start to see that difference. Yeah. I'm actually starting to see a little bit of it from all my hiking.
Yeah. It's interesting you say that because I'm very diligent with my sunscreen.
Yes.
And I put it obviously down on my neck and I wrap it around. But I did notice a little bit more sort of freckles or sunspots on the sides.
We forget. I mean, I forget even, neck. It's like back of hands and neck or and tops of the feet.
Yeah, but I don't forget anymore, trust me.
Not anymore. Especially not when we're on a mountain hiking, right, Marlo? No.
Can't wait.
Yeah, listeners, we're going to, well, I don't know when this is airing, but we're going to hike the West Highland Way in Scotland.
Oh, can't wait. Okay.
Back to rosacea.
Yes. So talk about difference between, you just mentioned difference between rosacea and redness. And why does it matter when it comes to treatment?
Well, because we really tackle them differently, right? I mean, if somebody's got a lot of photo damage, there's not a lot of inflammation there. So the rosacea treatments aren't going to help them.
Yeah.
Usually you're looking at laser treatments, which we're going to, I think, end off with sort of therapy-wise. So if they have components of rosacea, in particular bumps and pimples, we'll use topical anti-inflammatories and things like that. So it's a very different approach.
Okay. So what's happening biologically? You can explain.
With rosacea?
Yeah. With redness and rosacea.
Well, the redness we already talked about with sun damage. But so with rosacea, it's actually better understood than it used to be. But we do think that there's a group of people, and it's genetic, and that goes back to maybe ethnic background, Celtic, whatever. They seem to have the vessels in the surface of their skin just are more reactive. They open easier and they flush easier. I always use Prince William and Harry as an example. When they were younger, they had red sort of cheeks, but on the outer, that's just vascular instability. So the blood vessels are opening when they're not supposed to. They flush easily. So there is a genetic component that also leads to inflammation. Then there's nerve. There's these TRP channels, which a lot of treatments kind of target. They are sensory channels. And so that's why people get burning and stinging. So it's kind of a multifactorial, but vascular instability, inflammation, and sensory changes.
Right. Okay. That's it. Yeah. So interesting. Okay. So what about the microbiome?
Yeah. So whenever I do an episode, me, I take a deep dive on the literature. I didn't know this, but there's a common treatment for rosacea called ivermectin. Have you heard of it?
No.
And it treats, it is an anti-inflammatory, but it treats parasites. And so there is a mite, which is an organism that lives in our hair follicle. This is normal.
Okay.
It's kind of gross when you think about it.
I try not to think about it, but
you ever seen that stuff on Instagram where they zoom in on a strawberry and they go right into and you see the bugs?
Yeah.
We're eating bugs all the time. It's good for us.
We know.
So
builds our immune.
So patients with rosacea in this one study I reviewed do have a higher incidence of this mite in their hair follicle. But I find with that drug ivermectin, and I'm sure some listeners that have rosacea are using ivermectin, it doesn't work. It doesn't work with everybody.
Okay.
So I think that there are some differences again with this microbiome in certain individuals. There's some soft evidence about gut microbiome and inflammation, but that's still an evolving science. Okay. I do think there's a gut acne rosacea axis. But it's not like you can just go buy a probiotic and fix everything. It's not that simple.
Okay. Yeah. So just one story I read. I'm getting off topic here, off script, people. Have you seen the new Wuthering Heights?
I have not yet.
With Margot, I haven't seen it either. But there was this whole article about her and how she flushes. And it's really adding to the scenes because it's. I
wonder what does it look like a flush? It's just makeup.
I think she just naturally.
Well, she is
flushes.
She's Australian, so she's English way back when. She was a robber. Yeah, she was a thief that ended in Australia. Her family.
Okay.
Well, that's how they all got there, right?
Yeah.
So the English background. So she flushed easily. I mean, that's also very innocent and sexy, and I think they were trying to do that in this movie. It's a very different take on it, right?
Yeah. Okay, so let's talk about triggers. So tell us sort of what's going to set off someone's rosacea.
Well, we talked about that frankincense. Don't put essential oil straight up anything on your body, in particular your face.
Right.
90% of patients, like when we sit down and actually have a conversation with them, there are triggers, right? There's dietary things, so anything that makes you hot. Can increase your core body temperature, and that tells your body to flush, right? So spicy foods, alcohol. There's a study looking at 82,000 women study, huge study looking at rosacea and alcohol, mostly white wine and spirits.
Yeah.
Intense exercise. So, because you flush, right?
Sure.
A good tip there, I tell people that really flush when they exercise is, again, your body, like dogs, our lovely Odin here, he can't flush. So he pants. So humans, so your core body temperature goes up when you're exercising, and it tells your brain to flush. So if you keep sipping ice chips or ice water, and you keep the vagal nerve at the back of the throat, so it's telling your brain that you're actually not that hot.
Right.
You can actually stop the flushing as intense when you're exercising. So that's a good tip. I learned that at a meeting, actually.
That's so interesting. Obviously, nobody should smoke, but I'm guessing smoking
doesn't cause a problem. There's actually studies to look at that.
Oh, really?
Yeah,
okay.
They did. There was a study I reviewed.
But you shouldn't smoke anyway.
No, you shouldn't smoke anyway. Stress, wind, cold, heat. So I have occupational cases. I do occupational skin disease. So I've had patients who work in a bakery and they have to go in and out of the freezer, and their rosacea is going crazy.
Opening the hot oven.
And I have to actually write a letter to say they can't do those activities because it aggravates their rosacea. It's an occupational claim. I've done that several times. And wind is a big one.
Okay.
Wind. So
avoiding a lot of these things, which makes sense. But okay, let's talk about something people can do every day. What are the new products that are out? Let's move into skincare.
Yeah.
And because I think that's what really people
want to know.
Like there's hope, right? There's
definitely hope. So I think the foundation of so many skin disorders is a good skincare routine, okay? In particular in rosacea, because studies have shown, I reviewed multiple studies, that a good over-the-counter protocol regime will help your rosacea straight up. And then if that's not working, then you can add medication. So what does that look like? Obviously, no essential oils, little to no fragrance.
So avoiding, yes, okay.
Yeah, fragrance is an irritant. It's also an allergen, but it's an irritant. Soap-free, so no true soap, cleansers, pH balance.
Yeah.
And then ingredients such as niacinamide, azelaic acid, ceramides, because actually there's many studies now to show that patients with inflamed active rosacea have a barrier dysfunction, just based on the rosacea itself.
Okay.
So moisturizers that repair the barrier, and avoiding things that potentially might aggravate. So essential oils, but retinoids, glycolic acids. Doesn't mean you can't get there eventually if your rosacea is controlled. But starting off, very important. And sunscreen. We'll kind of circle back to sunscreen.
Yeah.
But
Yeah. We should all be using sunscreen, but that
in particular
In
for
particular.
rosacea, many studies show that it's a huge flare.
Okay.
It causes triggers in
Right.
rosacea.
So, okay, so let's talk about Bioderma's
Yep.
Rosactiv
Right.
technology.
So, I mean, that's part of they're sponsoring this episode. We want to definitely give them kudos. And this is a great technology. So I reviewed this in depth. Basically, this product or this active, Rosactiv, which is in their line. So they have a line called SensaBio AR, which is anti-redness.
Okay.
In Canada, we have a cream, we have a serum, we have a micellar water cleanser. I think you can get online. It's in other countries like a BB cream that's tinted, which is quite nice because that's great. You're going to help the redness, but also cover it a bit.
Okay.
Can't get it in drugstores here, though. That I couldn't find it online. So what does it do? It has basically this a couple different ingredients, but the main one that it affects, or the main biological thing that it affects, is something called vascular endothelial growth factor.
Okay.
So these are growth factors that cause the blood vessels to open. And so it decreases the production of that by 75% in studies. And Bioderma does a lot of in-house clinical studies, which is great. So this is going to decrease that sort of opening of the blood vessel, that flushing. It also has enoxabolone, which is something that decreases inflammation. And so all of these things are in that active. And in their clinical studies, it decreases redness quite nicely. So that would be a great foundational treatment to start with if people just have redness.
Yep.
And if that's not working, then you can go see the dermatologist.
Okay. I love that. So it's really about like building this routine.
Yeah.
Right.
And I
using
think
this, like using these products on a daily basis.
On a daily basis. And also what not to, like the not using is also very important.
Okay.
You know, like some people will come and say, I have dry hands, and they'll say, what's the best moisturizer? I go, you're asking the wrong question. What's the best cleansers? What you shouldn't be doing, as well as what you should be doing.
Right.
Yeah.
Okay. Got it.
Yeah.
So these, if somebody does need medication, these products can all be used along with treatment.
Well, actually, studies have shown, like tons of studies that I reviewed, not tons, I didn't review tons. Okay, a few studies I reviewed.
Let's be real here. Okay.
Showed that, and we know this in practice. This is real world dermatology. If I give you medication to treat your rosacea, but you're using the wrong skincare, the medicine won't work as well. And that's a no-brainer, but I don't think for patients it always is, because they just feel like they want to go to the store or go online and buy something else. And this is a case where less is more here with rosacea. But, and we didn't touch on sunscreen. So let's talk about sunscreen. The best sunscreens for rosacea are mineral-based.
Okay.
Because chemical filters sometimes can burn and sting rosacea.
Irritate.
Not everybody. So zinc and titanium, fragrance-free, SPF 30.
Okay.
Make sure you use it daily. Reapply if you're outside for long periods of time. All that stuff.
I do.
And then if they're tinted, it's it's kind of a win-win. I know the Bioderma AR line has a tinted cream that has a sunscreen, but I don't know if it's available in Canada.
Okay, but we'll check on that and get back to you. Okay, love that. So let's talk about people who like develop bumps and pimples with their rosacea. Let's talk about some other treatments that they can do.
So if we get into the actual prescription, there is a group of medications topically. I'll get to the oral ones eventually, but I don't use them very much. I don't like them. They're basically bind to the receptor on the blood vessels as an adrenergic receptor. So you make your blood vessel constrict or shrink.
Okay.
So you put these creams on. One's brononidine, and the other one is oxymetazoline. They're prescription. You put them on, and you actually see your face all the redness go away.
Okay.
Because it causes constriction.
Okay.
So and if you put too much, you actually look white.
Okay.
And it lasts for about 10 to 12 hours. The problem is when it wears off, in many of my patients, they get a paradoxical worsening.
Yeah.
So your blood vessels actually, you figure out, okay, I'm being like constricted, squeezed, and I'm gonna so I don't use them. I think they're great in that we often call medications like it's good in a toolbox. So like if you have a wedding, you have something, you can't get in for a laser to remove the redness, or whatever, you can use this for a special occasion, but I would never recommend it for daily
on a
use.
daily use.
Yeah.
So you just mentioned lasers. So
Or let's finish the creams.
Sorry.
That's okay, because I'd love to
I'm
get to the
jumping
lasers.
ahead of myself.
So we already talked about ivermectin. The most common treatment for rosacea, pimples, and inflammation is metronidazole.
Okay.
You've heard of that one.
Yes.
And azelaic acid. And then if patients aren't responding to topical medications, I will add low-dose doxycycline at 40 milligrams. This is an important point.
Penicillin, like an
It's
antibiotic.
an antibiotic, but at the 40 milligram dose, it's what we call bacterial static and not cidal. Cidal means death. So it doesn't kill off the bacteria in your gut.
Oh, interesting.
So it's okay to use for long-term use. So if people are really struggling with their inflammatory components like pimples, pustules, we'll put them on low-dose doxycycline.
Right.
And what I'm using a ton of...
Like people have acne, like if you see somebody
pimples,
right away.
The medications for rosacea aren't really treating redness very much.
Okay.
And they're not treating flushing. They're treating the inflammatory component.
Right.
And that's actually a miss. So patients will come and see me. They've been on, let's say they're on the low-dose doxycycline. They go, I'm still red. Well, it's not treating your redness. Your redness is blood vessels that are now permanently open, and that's where we're going to get to laser.
Okay.
So there's, it is important to see a physician. So topical, oral, then we're going to get to laser. And one last thing I want to mention about pills. I do this a lot in men. Low-dose isotretinoin, which is also known as Accutane.
Okay.
We use low-dose isotretinoin to treat really bad rosacea. People are just really red and bumpy, and it really affects their lifestyle and their quality of life. And the typical dosage for isotretinoin, if you're treating somebody teenager with acne, is 40 milligrams a day.
Okay.
Low-dose isotretinoin is 30 milligrams a week.
Oh, interesting.
So side effects are almost negligible. You can drink. You don't have to worry about the sun. It's listeners, if you have really bad rosacea, you're struggling, see a dermatologist to discuss that, because it can be a real game changer.
Okay. I love it, because I think we can give a takeaway if people have been struggling for years and they've tried all the over-the-counter creams, to give them sort of concrete advice when they see a dermatologist, and they can just say, listen, I heard this on Skin to It podcast, season 3.
Low-dose isotretinoin, please.
Yeah.
Check. Yeah.
Okay, so let's talk about lasers.
Right. So lasers can be a really big game changer too. I mean, if you have persistent redness that isn't going away, so pervasive redness, mid-face, nose, vessels around the nose, your only option is to, I always say to patients, you can't remove a physical entity with a cream. You can, that one drug we talked about, bronadidine, can shrink it for 12 hours.
Okay. But
you actually physically want to destroy it. And the way we do that is with laser. So IPL is sort of the gold standard. IPL technically isn't a laser. It's intense pulse light. But the gold standard for people that are really red, and we have a laser now in my new clinic at Victoria Park, which is exciting, is pulse dye laser at a wavelength of 580, 585. That's targeting the hemoglobin, which is inside the blood vessel. Okay. So when you target that, the hemoglobin absorbs the energy of the laser and it blows up the vessel.
Yep.
So the only problem with laser for redness is it's never a one and done. And I always feel like I'm a used car salesman, like, okay, we have to come back and you have to come back.
Like several sessions.
But you also have to come back yearly. Like you kind of have to do a top up.
Right.
Because we're not removing every blood vessel in your face. We already said these people have a genetic predisposition. Their vessels are just more. So you get rid of some and then it kind of replaces with new ones.
They come back.
It is a bit of a drag. So we recommend 1 to 4 treatments at the onset, spaced about a month apart. And then I kind of say, listen, just think about this as once a year maintenance.
Okay. Okay. Well, that's not like crazy.
No, it's not crazy.
Okay. Love it.
Better than a facial. Just if you got redness, don't get a facial. Go get your laser once a year.
Okay, Sandy, I think we learned so much, but I love to do a really good wrap up and takeaways so people can just...
Are you going to do that, the rapid fire thing?
Yeah. So we're going to do rapid fire. So there's skin to it. So either Sandy is skin to it, which means she's giving it the thumbs up, obviously, or she's not skin to it.
Right.
Which means you should not be doing that if you have facial redness. And
proceed with caution, wasn't it?
Proceed with caution. And so you can give us a little explainer if it's a proceed with caution.
And for the listeners, I don't know these, so she's just going to whip them off, and I'm going to just say what I think.
Okay, here we go. So ice rolling your face to calm redness.
Not skin to it.
Okay, splashing your face with ice water.
Definitely not skin to it.
Hypochlorous acid sprays for irritated skin.
Skin to it decreases pH, helps skin barrier.
Azelaic acid for redness.
Yeah, we already mentioned that in the treatment. Okay. Skin to it.
Niacinamide.
Skin to it.
Okay. Slugging with Vaseline when your skin barrier is damaged.
Proceed with caution.
Okay. Skin cycling to prevent irritation.
Skin to it.
Great. Gua sha to reduce redness.
Proceed with caution. Too much pressure can make it worse, but yeah.
Okay. Green color correcting creams for redness.
Absolutely.
For
Skin
sure.
to it. Yep.
Red light therapy masks.
Skin to it.
Great. Laser treatments.
Yep.
Yeah, I think I know your answer.
Yep.
Drinking chlorophyll water for clearer skin.
I know Dr. Doris Day did a thing on that. I think there's some benefit. I proceed with caution.
Okay. Probiotic skincare for sensitive skin.
Don't know. Proceed with caution.
Okay. Skincare fridges to reduce inflammation.
Silly. Proceed with caution.
Using diaper cream, zinc oxide on your face.
Not skin to it.
Okay. Washing your face with very hot water.
Definitely not skin to it.
Over exfoliating with glycolic or
I hope after
salicylic
this episode, people know.
acid.
Yeah.
Yes.
Not skin
We're
to
going to
it.
say no. Layering multiple active ingredients in one routine.
Proceed with caution.
Okay. Vitamin C on very sensitive skin.
Proceed with caution. Some people, and I want to make a note here, if you have well-controlled rosacea with medication, if you're at that stage, then you can tolerate some of these things. So just proceed with caution.
Well, and retinol.
And you can get there. You can get there sometimes.
Okay. Fragrance and skincare, that would be a no. Even I know essential oils. I'm
No.
gonna say no. We're not, neither of us are skin to that. Alcohol-based toners.
No. There's not even really that many left anymore. So
We're
not
going
skin
to say
to it.
not skin to it. Microneedling at home.
Proceed with caution.
Face steaming.
No, it's heat again. So no skin to it.
Avoiding spicy food. We said
Yeah.
you're not skin to that. I mean, you should avoid spicy food.
Everything in moderation.
Yeah.
Yeah.
Drinking alcohol and facial flushing.
Mhm.
Obviously, there's a correlation
Interesting, yeah, because red wine to me always was sort of the more problematic thing. But in the studies, it's white wine and liquor or spirits. So
there. Okay. Using mineral sunscreen for sensitive skin. We
Mhm.
are so skin to it. Sunscreen screen every day. Obviously, we're skin to it. And how about this last one? Doing nothing to your skin for weeks, which they call the caveman skin trend.
I'm totally into that. And I've done that on several occasions, and I discussed that in my book. When I went to the Arctic for 10 days, my skin looked the best it's ever looked. Like doing nothing
glowing.
to your skin. Yeah, camping and just letting nature do its thing. Your skin looks amazing.
Yeah.
Of course, I
Sunscreen.
did wear sunscreen.
Yes.
So I think that's a wrap, man. That was good.
That was great. I think it's tons of information and practical information.
And there will be show notes. So for some of the names of things, if you wanted to get that. And always reach out to us on social if you have any questions.
Yeah.
And thank you for joining us for another episode of Skin to It. Catch us every Thursday for a fresh exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin.